My name is Gardy Deshommes. I'm from New York City. I'm a disease intervention specialist with the New York City Department of Health.
I'm Anne Bennett. I am a research scientist at the New York City Department of Health and Mental Hygiene.
I'm Filipe Loureiro, and I come from New Orleans. I'm a adjunct professor at Tulane University.
Hi, I'm Susan Schoenfeld. I'm from Vermont. I worked for 25 years at the Vermont Department of Health. I retired in October of 2014. I was the Deputy State Epidemiologist and ran our TB program and our refugee health program.
My name is Mari Gasiorowicz. I'm with the Wisconsin Division of Public Health. I've been there about 20 years. I work mostly in HIV, recently on cluster investigations. The idea is to find people with Ebola, either themselves, cases, or family members, and find out who those people have had contact with, who the cases have had contact with since they developed symptoms. So the idea is that you can then find people and monitor so that if they develop symptoms, they can be isolated, and that way you can contain the epidemic.
I was told to be prepared to work in infection control or epidemiology. I have a background in both, with doing work in both areas in the Department of Health in New York. So ready to go.
I will be placed in Guinea, probably in Conakry. I know that my duties will be a bit on integrating work that has been done and coordinating with other players. And of course we have to be flexible, so I'm ready for the challenge.
As far as I know, I'll be working in epidemiology as part of the team. My understanding is when we get there, they figure out where they need the help and how our skills best match what's needed, and they'll direct us and do whatever they need. It's the crucial step right now in terms of stopping the epidemic. I mean, always you need to care for patients and cure them whenever you can, but in order to stop it, it's finding those links, getting people identified and isolated early. That's the way you end transmission, and so it's a really critical piece right now.
I think communication and understanding the community and to be able to gather the information and getting the trust of the people, the surroundings, and prevention is also key in understanding where we are and how we can move it forward. I worked for other infection in the 90s, and I believe that Ebola is just going to be the same. We're going to have an understanding and how we go about to be effective, and the public will see it just as they've seen how we transfer from tuberculosis and how we took care of HIV. Basically, it's just going to be the same way. So it requires us to have sense of community, understanding, and gaining the trust of the public and as well as the community. And then I think that's just going to be a thing in the past.
I think that for the general public, probably they are not so much aware of the importance of the epidemiology. Why do we have so many questions? Why do we contact people so often? And probably that's one of the problems that we have of sometimes not letting us to reach the results that we want as fast as possible. And what I think that needs to be done is good information, but good coordination among the players, and not forgetting that we are doing this for population. So if there is a good coordination among players, but there is a detachment from the grassroots, from the community.
I think there's a difference between what the public thinks when they hear different pieces of information, and epidemiology gathers the information and puts it together. And information is power. It's the power to understand what's going on and intervene appropriately. It's the who, what, where, when, in order to understand how and why something is happening and to be able to monitor how it's changing.
As Susan said, it's pretty exciting to be part of a bigger effort, and I always think that the global and local interplay well, and that from an opportunity like this, one comes back, a better state health department employee as well.
I do want to say how much I appreciate all the support from CSTE in our making this trip. I mean, it's not only that they arranged the funding, but there were a lot of steps involved that I hadn't anticipated in taking on working as a contractor with CDC and the different security clearances and briefings that needed to happen, and really appreciate the opportunity to do this that CST has created.